coming, Mrs. Winters. Yes, her results have just come back in. Her alanine aminotransferase is 32. Her creatinine levels are 45. Coming, Mrs. Winters. Again.
Hang on in there.
Yeah, you're right. Well, I'm lucky. Soon I'll be qualified, so I'll have a bit more money. It's been hard, though. Well, I can't believe they throw away all that food in the canteens. I mean, they should give it to the nurses to take home at the end of their shift. Smoking keeps my appetite at bay, saves me money. Yeah, I know there's no logic in that. When I was an air stewardess, we weren't allowed to eat the extra meals either, but at least we were paid more then and got to see better sights, better than bodily fluids all day. Well, actually, to be fair, we got to see our fair share of those as well. You'd think I'd learn.
So, have you made the right career choice now?
Oh yes, I love being a nurse. Where else do you get to do the simplest of tasks? I don't know, like putting someone onto a bedpan. That intimate care where you really get to know them. Well, you know that they feel that you're on their side. It really humanises a patient. I love that. Less drunks on board too. Oh, well. But we didn't have all those sugary snacks there. I mean, on the wards at night, I can't believe it. It's like a culture that we're expected to eat all that sugary stuff. Crap, to keep our energy up. So, you know, when we hit that brick wall at 5 a.m, when we all know that a handful of nuts or a banana is the answer. Just habits, I guess. Even I've eaten lasagna at 4 a.m, because you don't know when you're going to eat again. You just eat as much as you can in half an hour. Go, go, go. Well, it's mad. I guess we just all follow the nurses just above us. We don't break the mould. Smoking calms my nerves. I've had some close shaves going home after a late. Well, feeling stalked? I know it's ridiculous, but with a cigarette in my hand, I just feel more confident. Well, in all sorts of circumstances, actually.
Do you not get any training?
There isn't any training module about self-care on mad shifts, mad people. So nurses just think they can manage everything until they find they can't. And, well, I guess that's what's happening now. That's what we're seeing now. In what you say, overeating, smoking, drinking, and no one's leading the way.
You seem as if you could.
Me?
Yeah, lead the way.
Nurses are seen as followers. Doctors are the leaders.
Couldn't you change that?
What? Form a healthy eating, less drinking, non-smoking club. No one would recognise me.
So, you think this is going to be your career for some time now?
Oh, God, no, I don't want to retrain again. Or ever leave nursing, actually.
So for the next 40 years?
40 years? How old do you think I am? I'm 32 already.
Sorry, of course. I don't mean... It's just... Your body won't be able to remain healthy with your current habits. Sorry, it just amazes me that young, intelligent women like you, and male nurses too, right, who all see the carnage reaped from unhealthy living habits daily, the diabetes, the cancers. I'm just beginning to take stock myself. Because my own mum, anyway, I don't need to tell you all this. You know the stats, you know the data.
It's difficult to change the nature of a nurse. It's all consuming. We're in this bubble of nights or whatever together. Yes, we know the stats. We've learned them by heart. Every day I smoke after age 35, I lose 6 hours of life.
Hashtag Healthy Nurse could start today. It just takes one nurse to lead the way.
Yeah, but...
Yeah, but...
Yeah, okay. But we need releases. Smoking is the way I cope. Draw breath, literally. Everybody needs a nurse, but nobody champions us. All these programs following junior doctors, paramedics, nothing about nurses. It doesn't help that we're not valued by others. Do you know, a nurse from my intake committed suicide recently. I know, and there's plenty others with anxiety problems. I smoke. It helps for now. I mean, soon I'll be qualified and all that support I've had will disappear, and that worries me even more.
So you'll need to find other, healthier support systems, other than smoking, I mean.
Nurses are very practical people. We just keep going.
Is it healthy to be that sacrificial? Sorry, what do you do with your time off? I mean, hobbies.
Well, there isn't much time for anything, what with studies and assignments. But from now on, I don't know, I like the movies.
What was the last movie you enjoyed?
Mamma Mia.
Oh, God, I hated that.
Well, you did ask.
Oh, I did, didn't I?
I hate role plays.
Well, Sally, as you're a pro,
What are you saying?
will you be the nurse and Rachel, you be the manager. Here are your scripts, but feel free to improvise.
So, before you go, there's just one issue I'd like to raise.
Yes.
We're finding that many of our nursing staff that are overweight are benefiting from attending slimming clubs. And I have some vouchers if you're interested.
Are you saying I'm fat?
Well, not in so many words.
How many words do you need?
Go on, keep going.
Well, you need to say to yourself, my well-being is crucial. Otherwise, I will end up dead.
Oh, whoa.
Well, think of this as an MOT for nurses to see if they are fit to practice.
I do carrots, not sticks.
Well, okay, why do you overeat?
My weight is my business, and should I decide to do anything about it, I'd make my own arrangements. I mean, you can stick your slimming clubs.
Sorry.
Sally, are you okay? So I forgot we were doing role play. A bit of me came into play there. It's just such a personal thing, isn't it?
Well, it's not as though you're really overweight.
Thanks, but I have been for years. It's just facing it, isn't it?
It was projectile all over me.
Okay, moving on.
Yeah, well, how are we going to finish the film positively without Sally in it?
I've got the footage, and we have you two. So now can we just do a read-through of all the Birmingham nurses' suggestions first? Quick fire style, okay?
Right. Find other ways to unwind.
Take up some exercise you enjoy and that fits around your work and family.
Just deciding to start today and then do it.
Hang on to the vision of a healthier, happier self.
Relatives could give donations to a pay-forward system for thank yous that we could all decide on, like a bean bag for the staff room or whatever.
Instead of sweets. All the chocolates that I have eaten over the years, even strawberry creams, and I hate them. Oh!
Hospitals arranging group exercise or yoga on site.
Managers insisting on breaks, including mindfulness minutes in the day, maybe at handover, instead of escaping off with that fag or whatever.
Busted. That was for me, wasn't it? Maybe health checks in hospital, so you can get your nicotine patches on site.
And subsidised healthy tea trolleys coming onto the wards day and night. This project has got me thinking.
Oh dear.
Seriously? Ward sisters like me, we need to lead the way, setting the standard, the expectation, saying that this is how our team works. And on this ward, we are going to work to keep each other fit and healthy for work emotionally and physically.
Great. What will you do?
Speak to my fellow ward sisters and put this on the agenda for departmental meetings. This has got to be sorted by up above too.
Amen. Well, what about asking nurses to volunteer to slim or, yes, give up smoking with a group of patients as a sort of leader?
Yes.
And you visiting us regularly would help the most.
That'll definitely help. Oh, but that's it though, isn't it?
Well, we've got one follow-up filming session in 4 months. I'll email you dates if you're both okay with that. Great. Well, let's film that properly now then, shall we?
Can I just have a quick break?
Thwart that craving with a bit of positivity, Rachel.
Oh, okay, I'm thwarting.